Hey, it's Dr. Matt with Green Dental. I just wanted to take some time to discuss dental implants and the dental implant process. So, all a dental implant is a man-made tooth root. It's a titanium screw that will place into your upper or lower jaw where you're missing a tooth. And then once it's healed, it allows us to come in and put a tooth on top of the implant. Why you may need a dental implant. One reason is you're already missing a tooth, and we're hoping to get that replaced. Another reason is you have a tooth that needs to be extracted, and we'll want to replace that tooth once we extract it. And then the third reason is if you have dentures and we're looking to hopefully stabilize those dentures with some implants. So in the first scenario where you're already missing a tooth, what we would need you to do is just come in, take a 3D scan for the doctor to evaluate the bone and determine if you're a good candidate for an implant. If that's determined, we'll then schedule you for your surgery. The surgery itself usually takes about 45 minutes to an hour to place the implant. Once that's placed, we have to wait about 4 to 6 months for the implant to heal, and then we can come back and place that tooth on top of it. The second scenario, where if we're looking to extract the tooth and then do the implant, there's two routes we may need to go. So if we determine that the bone looks really good at the time of extraction, we can actually place the implant at the exact same time we extract the tooth. If we determine that the bone is not adequate to place the implant at the time of extraction, we would then need to place a bone graft, let the bone graft heal for about 3 months, and then we'll have you come back and place the implant and let it heal for again 4 to 6 months before we can have you come back and get that digital scan for the lab to make the crown. So once everything's healed and we do that scan appointment, we send the scan to a lab and they'll make two components. So one component's called the abutment. That's the portion that actually screws into the implant and will serve as a base for us to then cement a crown on top of. If you're in the category of wanting to stabilize your dentures with implants, it's a little different. Again, it all kind of starts with that 3D scan to make sure we have enough bone to place the implants. Once we determine that and the implants get placed, it's the exact same process. We'll let everything heal for about 4 to 6 months. The big difference in this scenario is rather than us scanning and sending out to a lab to make a crown, we have you come back in. We place some special posts into those implants that then stick up above your gum tissue. And then those allow us to then anchor the denture and stabilize the denture. Cool. Thanks.